October is Breast Cancer Awareness Month, and there has been renewed focus on addressing the myths and fears attached to diagnosis and treatment. While early detection is key to effective treatment, many barriers are hindering efforts, including fears around breast cancer screenings, low income or worries about cost, and a lack of awareness breast cancer risks. Let's unpack this further now. I'm joined by Oncologist Dr Dineo Tshabalala. Doc, good afternoon. Welcome to today, and thank you very much for your time. I mean, there's a lot of stuff that you hear when you talk about breast cancer. I mean, predominantly it affects women, but men as well may get breast cancer. Just an overriding question first. What kind of progress have we made as a country in dealing with breast cancer?
Afternoon, and Dr. Moyane, thank you for having me on your show. I think it's a relevant question that you ask. As a country and worldwide, there's really been a lot of development and a lot of interesting developments in breast cancer treatment. Treatment for breast cancer is no longer one size fits all. We're moving towards individualized care for breast cancer patients. You find that breast cancer is also not one disease. Patients have different types of breast cancer. For instance, as you rightfully say, breast cancer does affect men, both men and women. But you find that the less than 1% of men that are affected with breast cancer usually have a strong family history of other familial types of cancers, hence they then develop breast cancer. And most of the females that do develop breast cancer do not necessarily have a strong family history. But if you do have a strong family history of breast cancer, then you obviously are likely to develop the more aggressive types of breast cancer. In terms of therapy that has been developed over time for breast cancer, you look, for instance, at triple negative breast cancer. You find that chemotherapy is redundant in triple negative breast cancer, and you find that we're treating patients with triple negative breast cancer with your more novel agents like immune therapy. Also, you find a type of breast cancer called HER2 positive breast cancer. We're lucky enough in our country that our government is paying for our state patients to get a certain molecule called trastuzumab. Without trastuzumab, those patients were doing very badly in terms of their cancer care and that they were receiving chemotherapy alone. But with the addition of the trastuzumab, we're seeing better response rates of the cancer, and where people are living longer after they've been treated for their breast cancer. Of course, we could do better because there are other molecules that are being used for this type of breast cancer, HER2 positive breast cancer, but there's clinical trials available for patients, and patients are able to be on better molecules that are used in Western countries. Treatments like pertuzumab, which you add to trastuzumab, it deepens your response to the treatment and gives you better responses that by the time you get to surgery, the lesion has almost disappeared. And that's what we look for as oncologists. If you have a better response, then your survival is longer.
Against this background of such progress and these clinical trials that are happening that you've just explained so nicely, Doc, are self-examination still recommended for breast cancer? Do they assist in early detection still?
Absolutely. In fact, most of the breast cancers that are diagnosed, the diagnosis comes because a patient had breast awareness and examined themselves at home. It's very important that women, especially over the age of 35, do partake to doing breast examinations on themselves in the shower or when you're dressing up in front of your mirror. You don't have to do it on a daily basis, but I would really encourage women to be more aware of their normal breasts so that when an abnormal eventuality happens in their breast, or a mass that shouldn't be there, or a discoloration of the breast that shouldn't be there does occur, they're able to make sure that they go to their nearest health provider and seek help so that the breast cancer is not missed.
Yeah. Now, not all breast lumps are cancerous, one would assume, because we do get all types of lumps. If you have a lump in your breast, may not mean you've got cancer, though. What are some, though, of the symptoms you should be looking out for that you may take lightly and then miss and ignore that you should be taking that lump seriously and miss something?
So that's a very important question that you asked, Mr. Moyane. It's important to know that in younger patients, those under the age of 45, on a monthly basis, there is a mass that occurs in your breast called a fibroadenoma, and it occurs usually when you're on your monthly menses. So it occurs when you finish your menses, it disappears again. That's a benign lesion. It's normal for every young fibrous breast. It's got a nickname called the mouse. So if you've got a fibroadenoma, you're younger than the age of 40, it's not painful, it's normal, it's part of your normal physiology. However, there are some lesions that when they do occur in your breast, you should pay special attention to, not ignore them, and seek help. So if you've got redness in your breast and you're not breastfeeding, even if you are breastfeeding and you've got redness in your breast that's painful and your breast is tender, you need to seek help. Oftentimes, the younger patients are turned away from our health facilities because they're told it's related to the breastfeeding and they've got an infection in their duct. There's an entity called inflammatory breast cancer that occurs as redness on the breast. It looks like an infection, but it is breast cancer. Please ask your health provider to send you to a facility where they specialize in breast care, or a surgeon that has an interest in breast cancer management. Some of the lumps are not painful, but if there's a lump that's there, does not disappear, is not easily mobile, there's puckering of your skin, it starts looking like an orange peel, that's called peau d'orange, then you need to seek help. If you start having a discharge from your breast that's not been there before, please seek help. And remember, not all breast cancer will have a mass lesion. Inflammatory breast cancer will just be redness with no mass. And oftentimes it's missed because there's no mass. It's not equals to breast cancer. Meanwhile, it is breast cancer. So seek help in a facility that specializes in breast cancer management.
How often should women undertake a mammogram screening? And while answering that, and if you may be brief, Doc, there has been some concerns in America that there's a little bit of radiation that the mammogram would have. Is there concerns there as well?
So if you look at a mammogram, yes, it's a form of X-ray examination that is done on the breast, but the radiation that you would be exposed to in a mammography is minuscule compared to even the normal background radiation we get in the environment. So a mammogram, for instance, is better at picking up breast cancer in an older patient versus a younger patient. So I would say the risk far more outweighs the benefit of a mammography. There's no ways that a mammogram X-ray radiation exposure is going to lead you to other malignancies. There's the conventional X-ray that you do for your chest, yes, that would, with time, repetitively,
and how often
increase your risk of developing cancer.
Yeah, how often?
The screening, according to the latest American Cancer Society, screening, if you're not high risk, if you're of average risk to develop breast cancer, should start at the age of 40. Other journals have suggested that you should even start at the age of 35. Once you start screening for breast cancer, whether it's at 40 or 35, it's a yearly screening that you do at your facility of choice. You continue with a yearly screening, even if they do not pick up a breast cancer, because we know that breast cancer, even if you have average risk, in your lifetime, you've got a 15% chance of developing breast cancer with advancements of age.
Dr. Dineo Tshabalala, thank you so much for your time this afternoon on Today and enlightening us about the whole issue of breast cancer. October, of course, being Breast Cancer Awareness Month. As we're wrapping up, we thought we should just get a sense of what's happening currently and get some tips from an oncologist